I'm Ranjit Gill. I'm a GP and I'm the Chief Clinical Officer for Stockport Clinical Commissioning Group. So Greater Manchester is the sick man of England. We spend more on healthcare than almost anywhere else in England, but unfortunately the treatment and care and service we get is much less good than it could be or should be. And devolution is intended to change that. Devolution, in my mind, is making the biggest and fastest improvement to the health outcomes for the people of Greater Manchester, and devolution gives us the opportunity to join the entire health and social care system together to achieve that pace of change and have Greater Manchester start to have the same or better outcomes than everywhere else in England. So part of our problem in Greater Manchester has been that decisions have been made about Greater Manchester outside of Greater Manchester, sometimes by distant bureaucrats in London making decisions about individual organisations or individual problems and not looking at the Greater Manchester perspective as a whole. So over the years we now have a system of health and social care that's regulated from a distance, where the money spent on behalf of Greater Manchester isn't decided upon by Greater Manchester. And we now have a health and social care system where we're spending much more of our money than we should on too late care for a small group of people, rather than spending our time and effort on preventing people from becoming ill in the first place, because 4 out of 10 cancers are preventable. Most heart disease is preventable. Diabetes is preventable. These are big issues, and the power of prevention is something we've never really exploited in the NHS. And devolution gives us the power to do this kind of change all across Greater Manchester. The health system and the local authority system hasn't worked together well anywhere in England. We haven't done enough to address the problems of emissions. We know that poor quality air causes people harm, and we know in Greater Manchester more people than elsewhere suffer respiratory problems, significantly because of air pollution. We need to take charge together, health and social care, with local authorities around the issues of emissions and the environment. We also know that more people in Greater Manchester come to harm from excessive alcohol consumption than elsewhere in England, and we need to work together with local authorities on the regulations about licensing of alcohol sales, and also with local authorities on the licensing and rules around tobacco consumption, because tobacco consumption is one of the biggest causes of harm. We want to help people have a plan to look after their own health, and that plan can be available online for them wherever they are and for their loved ones. If people have a frail elderly relative living on their own, then the plans we want to construct with people and their carers should be available 24 hours a day, 7 days a week, to whoever looks after them wherever they are in the country, whether they're in a hospital, in a GP surgery, at home, wherever they are. So freeing up information, allowing people to look after themselves better. And then we want to do more to help people understand their own risk of ill health by giving them a personalised risk assessment and a plan which talks about how they can change their own lifestyle and reduce their risk of suffering illness. We hope in 5 years' time fewer people will be off sick from working because of mental health problems. We hope that there will be fewer people than now suffering illness, cancer, diabetes, heart disease across Greater Manchester. We hope that Greater Manchester by then will become more economically powerful, generating more jobs, wealth, and therefore making people healthier. And wouldn't it be great if in 5 years' time Greater Manchester was no longer the sick man of England, but was actually seen, and we could measure and prove, had become one of the healthiest places in England to live.